Well, hey there, it's Liz Rohr from Real World NP, and you're watching NP Practice Made Simple, the weekly videos to help save you time, frustration, and help you learn faster so you can take the best care of your patients. So I have very few pet peeves. I'm pretty chill, and I don't even feel like this is a pet peeve necessarily, but if I had to consider it, it has to be around Nexplanon kind of knowledge and counseling, because really what happens is that, so I do Nexplanon insertions and removals. I love women's health. Reproductive justice is really important to me. And I definitely find that some providers feel very squeamish about it. And I don't know if it's from lack of knowledge or just disinterest, but basically what happens is that either one, I will have a patient who comes to the visit for their Nexplanon insertion and hasn't really been counseled at all. And so they don't really know what they're getting themselves into. And then my very small, I have 30 minutes for that procedural visit, but that takes an entire half an hour typically. I'm pretty fast now, but it still takes a lot of time. And so what happens is that I'll do the counseling and the procedure in the same visit, and then I tend to run behind. I don't even care about that, quite honestly. The pet peeve is just that is really more the second scenario that I see. They have patients who are coming to me for an Nexplanon removal that I didn't place, that I didn't know about the counseling. I wasn't involved in any of that. And so they're coming to me being like, I want to take this out. I just had it placed last week because of these side effects. And really that should never happen. Let me backtrack. So usually that's totally fine. The way that I frame my Nexplanon counseling is that they have complete control over their bodies and they get to decide when it gets inserted, when it gets removed, that whole thing. But the scenario was more talking about like, I had no idea this was going to happen. Like that's the thing that really frustrates me. And so in this video, I'm going to be talking about kind of everything that I recommend, keeping it short and sweet so that you feel comfortable when patients come to you asking about Nexplanon, so that you can kind of give them an overview. You don't have to be an expert. It's really pretty straightforward. I'll just tell you exactly what I tell my patients, and then you can hopefully bring that back to your practice. Whether or not you feel like you like gynecology or not, or if you feel comfortable or not, hopefully we'll make it really simple. So first, I just want to talk about the procedure itself. So it's a 30-minute procedure. Typically, it depends on your clinic and what your policies are. 30 to 45 minutes are scheduled for insertions and removals. There's an informed consent form that you go through the risks, benefits, alternatives, side effects. Hopefully, again, you've been pre-counseled those so that you kind of know what you're getting into, and you're just kind of like reaffirming those. Patients will sign that. You'll clean off the area. It's a sterile procedure, so cleaning it off with iodine, giving an injection of lidocaine, usually with or without epinephrine. It's up to the personal preference of the provider. And that is actually the worst part, because a lot of patients are asking like, oh, is it painful? Is it uncomfortable? It basically feels like a stinging, like a bee sting. That's what I've been told. I haven't experienced it myself, but that's the worst part because everyone's numb after that. And so once the numbness takes over, the device is injected through a very kind of large needle. So I usually ask patients if they want to watch or not, but it's just an applicator device, kind of like 2 seconds. It's really easy to insert. And then I just wrap up the site of insertion with a Band-Aid and some of that pressure gauze that kind of keeps it wrapped up so that you can reduce the bruising afterwards. And then the patients are just advised to watch out for pain, infection, and bleeding. Those are the main kind of risks of the procedure. And then coming back if they have any things like redness or discharge or fever or anything like that. Hopefully avoided because it's a sterile procedure. And then the removals are the same thing. The removals are informed consent, anesthetic. And then the main difference is that there's a very small incision with a scalpel, about 1 to 3 millimeters. Again, everything is numb, so they really don't feel anything. And then same thing, we just wrap it up afterwards. And then the main thing about insertions is that it takes about 7 days until they are fully effective. So they need some sort of backup method. One other thing to consider is that patients will frequently come to their visits. If they are a female patient with a male partner, a cis male partner, they will, and they are not using other contraceptives. If it's been within 10 days that they've had unprotected intercourse, they could possibly be pregnant without having a positive pregnancy test, if you remember that one. But I do recommend having those conversations with patients before they come in. And I'm not necessarily like fond of they have to come in for the counseling visit. Like if they can't and they come to the procedure and I do the counseling, that's fine, because I really don't want to make a barrier to access to contraception. But just kind of keeping that in mind, that those are kind of the recommendations. If you can if they bring it up in the appointment, or if you're offering contraceptive options for them, just kind of mentioning that. And then the only other thing is the main other thing, I guess I should say, is about side effects. And this is the number one thing I want you to keep from this video, is that you don't have to be an expert. It can kind of just be quick and easy. So this is the way that I tell my patients. So basically when it comes to the Nexplanon, it's good for 3 years. You can take it out anytime. And it's really, really effective against protecting you from pregnancy. But there are a couple of side effects. Most people are really thrilled. Most people love the Nexplanon in my anecdotal experience. However, there are some side effects to consider before deciding if this is right for you, right? So number one is bleeding. Absolutely number one across the board, most common side effect. And there's 4 different options. 1, your periods stay the same. 2, you get no period at all. 3, you can get this kind of irregular spotting, meaning small amounts of bleeding here and there, kind of erratically, or maybe a full-fledged period, just here and there, kind of like not really on a schedule. And then the worst case scenario, which is very rare, but I do have to tell you this could be an option, is that somebody gets their period and it never goes away. So like they literally have a period every single day until you remove the Nexplanon again. And I let patients know that like most of the time when patients get the Nexplanon and they have some side effects, their body will get used to it. So I usually recommend giving it a trial about 1 to 3 months to see how they feel. And if they get that intense kind of like daily bleeding that doesn't go away, to please call me, because there are things that we can do about it for them. So far and away, that is the most common side effect that I definitely hope that you can take away from this in your counseling. And then there are other kind of like less common side effects. So one is headaches. So if somebody has headaches already, there is a risk that it could get worse, or they could get like new headaches that they didn't have before. So that's just up to their discretion if they're willing to risk that for the benefits of having like a long-term reversible contraceptive, the LARC factor, that they don't have to think about taking as a pill every day. So there's the headaches. And then the other one is mood, definitely. So patients who have depression where it's not managed completely, or bipolar that's not managed completely, could definitely get worse. Or even if it's under control or well managed, it can kind of get worse. And then there's a couple of other questions. So acne and weight gain. So weight gain is not necessarily as much as, for example, like the Depo Provera injection, but there is about a 14% of weight gain risk, and I don't necessarily have data on the amount of weight gain. And then acne is again about like 14%. So if somebody had really bad acne, you might want to consider like not. I offer that to them as a risk, and they get to make that decision, right? And so there is a chance that your acne could get worse. So you can kind of have to weigh it from there. So those are not the only side effects, but those are like the main ones. Definitely the bleeding is the most important one that I feel like it's just so super easy to get off the bat and see if they're even willing to entertain any abnormalities in their menstrual cycle, because some people are and some people aren't. So that's it. So hopefully this video was helpful. And if you've made it this far, all the way to the end, thank you so much for making my dreams come true of provider collaboration. If you like this video, hit like and subscribe and share with your NP friends, so together we can reach as many nurse practitioners as possible to make their practices a little bit easier. And if you haven't already, grab the ultimate resource guide for the new NP. Head over to realworldnp.com/guide. You'll get these videos sent straight to your inbox every week with patient stories, more insights, bonus content that I really just don't share anywhere else. Thank you so much for watching. Hang in there, and I'll see you soon.